If your surgeon has told you that your mesothelioma is unresectable, or if this term appears in your medical records, you need to understand exactly what it means. Does unresectable mean your cancer is terminal and nothing can be done? Does it mean every surgeon would refuse to operate? Or might you still be a surgical candidate at a different center with different expertise? Today, I want to explain what resectability means, what factors determine whether mesothelioma is resectable, why assessments can differ between surgeons, and what your options are if you're told your disease is unresectable. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this is not medical advice. But understanding resectability helps you evaluate your options and know whether to seek additional opinions. So let's start with what resectable and unresectable actually mean. Resectable means the tumor can potentially be surgically removed. For mesothelioma, that doesn't mean removing every single cancer cell. That's virtually impossible with this disease. But it does mean that the surgeon can remove all or most of the visible tumor, and that's called complete or near complete cytoreduction. Unresectable means surgery can't adequately remove the tumor, either because it has spread too extensively, because it involves critical structures that can't be removed, or because attempting removal would be too dangerous or futile. For pleural mesothelioma, resectability depends on several factors. The extent of the disease is primary. Has the tumor invaded through the diaphragm into the abdomen? Has it invaded into the heart or major blood vessels like the aorta? Has it spread to the opposite side of the chest? Has it spread extensively into the chest wall or spine, or to distant organs like the liver, bones, or brain? If any of these are present, the tumor is likely unresectable. The involvement of critical structures matters. A tumor that is encasing the pulmonary artery or invading the heart might make surgery impossible without unacceptable risk. Extensive involvement of the esophagus, trachea, or major nerves can also make resection impractical. Now, there's a lot to cover here, and before I go on, I want to take a break and ask you to do me a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. And if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end, because that's where I'll give you valuable information on where to find resources that will make a real difference for you. Now, other factors, disease volume and pattern definitely affect resectability. Bulky tumors that have created a thick ring around the entire lung might not be removable without unacceptable tissue destruction. Diffuse sheet-like tumor extensively coating all the pleural surfaces might be resectable at specialized centers, but deemed unresectable at a community hospital. For peritoneal mesothelioma, the concept is similar, but uses different criteria. The Peritoneal Cancer Index, or PCI, quantifies tumor burden. A PC above 30 to 35 is generally considered unresectable because complete cytoreduction is unlikely. Disease involving critical areas where vessels enter the liver or extensive small bowel involvement might also make surgery impossible. Patient factors also affect resectability. Even if the tumor is technically removable, surgery might not be offered if you have severe heart or lung disease that makes you unable to tolerate the operation, a performance status that's too poor to survive major surgery, or if you're of an age or level of frailty that make recovery unlikely. These are medical contraindications rather than actual tumor unresectability, but their practical result is the same. They mean you're not a surgical candidate. Why do different surgeons sometimes disagree about resectability? This is where it gets complicated and why second opinions are so important. Surgeon experience and skill matter enormously. A mesothelioma specialist who performs dozens of these operations a year might consider your tumors resectable, while a community surgeon with limited experience views it as unresectable. Surgical philosophy varies too. Some surgeons are aggressive and willing to attempt resection on borderline cases, while others are conservative and only operate when complete cytoreduction seems highly achievable. Neither approach is necessarily wrong. They just reflect a different way of balancing risks and benefits. Institutional capabilities matter too. A center with extensive support services, specialized ICU teams, and resources for managing complications might accept higher risk cases than a community hospital would. The quality of the imaging study can affect the assessment. Superior imaging might show the tumor extent more clearly, sometimes revealing that the disease is more or less advanced than initial scans suggested. Can unresectable disease become resectable? Sometimes. Neoadjuvant chemotherapy or immunotherapy given before surgery could shrink tumors enough that disease that's initially thought to be unresectable becomes resectable. This doesn't work for everyone, but it's worth considering. If your tumor biology is favorable and your treatment response is good, reassessment after several cycles of chemotherapy might show improved resectability. Does unresectable mean untreatable or terminal? Absolutely not. This is a critical point. Unresectable means surgery isn't appropriate or possible, but it doesn't mean nothing can be done. Chemotherapy, immunotherapy, radiation for symptom control, palliative procedures like thoracentesis for pleural effusions, and clinical trials of novel therapies are all available for unresectable disease. Many patients live for months to years with a good quality of life by using non-surgical treatments. Unresectable does not mean hopeless. For peritoneal mesothelioma specifically, the distinction between resectable and unresectable has enormous prognostic implications. Resectable peritoneal disease treated with cytoreductive surgery plus HIPEC has a median survival of 4 to 5 years. Unresectable peritoneal disease treated with chemotherapy alone has a median survival of about 12 to 18 months. It's still better than doing nothing, but it's going to be dramatically different from what a surgical outcome could be. That's why accurate resectability assessment is so important for peritoneal patients. Now, what should you do if told your mesothelioma is unresectable? First, ask why. What specific factors make it unresectable? Is it tumor extent, location, your medical condition, or some combination of these? Understanding the reasoning helps you evaluate whether the assessment is definitive. Second, ask whether neoadjuvant treatment could change your resectability status. Could chemotherapy or immunotherapy shrink the tumor enough to make surgery possible? Third, if you were evaluated at a community hospital, get a second opinion at a mesothelioma specialty center. Different surgeons with more experience might have different assessments. It might be worthwhile to get a second opinion, even if you've been seen at a dedicated cancer center. Fourth, if multiple experienced mesothelioma surgeons agree that your disease is unresectable, you need to accept this and focus on effective non-surgical treatments rather than continuing to seek surgeons who might operate. Sometimes patients do find surgeons willing to operate despite their disease being functionally unresectable, but undergoing surgery that can't achieve adequate tumor removal provides no benefit and causes significant harm through complications and recovery time that could have been spent on quality of life and time spent with loved ones. Fifth, ask about clinical trials. Some trials specifically enroll unresectable patients and they're testing novel approaches. Can resectable mesothelioma tumors become unresectable while you're making the decision about surgery? Mesothelioma typically grows over weeks to months, not days. Taking several weeks to get second opinions and make informed decisions rarely changes your resectability status, but don't delay indefinitely. If you're resectable now, pursue surgery within a reasonable time frame rather than waiting months while the disease potentially progresses. To review, unresectable mesothelioma means the tumor can't be adequately surgically removed due to extensive spread, involvement of critical structures, high disease volume, or medical factors that make surgery too risky for the patient. For pleural disease, this includes invasion into vital structures, contralateral spread, or distant metastasis. For peritoneal disease, a PCI over 30 to 35 typically indicates unresectability, and resectability assessments can differ between surgeons based on experience and philosophy. Unresectability does not mean untreatable. Chemotherapy, immunotherapy, and other approaches remain available, so get a second opinion at a specialty center if you've been assessed as unresectable at a community hospital. You can visit mesothelioma.net for more information about resectability and treatment options, or call 800-692-8608 or use the live chat feature to work with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.